Hello friends, I am Arpit and I am here with today's analysis. Today is 9th of April and we will be dealing with two very important topics which are in news. First is maternal mortality in India, a UN report which has been published by multiple agencies under United Nations, and according to this report, maternal mortality in India still remains to be very high. The maternal mortality deaths in India are the second highest. Highest are in Nigeria, second highest in India and Democratic Republic of Congo, and on the third position is Pakistan. Combining these four countries, 47% of the maternal mortality deaths which have happened all across the world have happened in these four countries. Well, the silver lining is that there has been substantial reduction also in maternal mortality from 2000 till 2023. But yes, a lot needs to be done further in this. Second is also a report which is published by Ministry of Statistics and Program Implementation, and this report is all about women and men in India. 2024 is the survey year, and that is why the full name of this report is Women and Men in India 2024. It highlights about various indicators about women participation. It highlights about labor force participation rate. It has improved for the women. Participation of women in electoral processes, it has improved for women. Then participation of women in financial inclusion, that has become better. Demat accounts for women have increased over the years. Gross enrollment ratio, there is a parity which is being witnessed between male and females now. That is a good news. So yes, this report overall is, I would say, a glimmer of hope for women empowerment in the country. But yes, still we need to do a lot. Basically, the psychological factor, that is patriarchy, that has to be diluted. So this is what is highlighted in this report. Then we will be dealing with the MCQs based on these two topics and discuss the answers to the MCQs of yesterday. So let's get started with the first. Maternal mortality in India. Maternal mortality simply means death of a woman in the process of giving childbirth. Right from pregnancy till, I would say, post-birth. If the woman dies during this or due to this process, due to pregnancy, then that is referred to as maternal mortality. Maternal mortality in India has been prevalent, no doubt about this fact, and as per this report, India is the country which is having second highest number of maternal mortality. And this is due to multiple factors. Lack of healthcare services delivery, that is one such factor. Lack of infrastructure to deliver those services, another factor. Lack of adequate nutrition during pre and post pregnancy. Then, we are going for uninstitutionalized deliveries, that is also one factor. Some diseases like gestational diabetes or hypertension. Gestational means during pregnancy, due to the disturbance of hormones, these kind of diseases, they happen to the females. Gestational diabetes it is called as, and at times, or most of the times, it gets over after the pregnancy is over, childbirth has been done. At times it does not get over, it becomes a lifestyle disease. But yes, these two diseases, gestational diabetes and hypertension, are also one of the leading causes of death of females during childbirth. Worse, during COVID years, maternal mortality increased because resources of the already struggling healthcare setup of the country were diverted towards managing the COVID situation. Apart from it, those pregnant women also acquired COVID, due to which complications arose among them. So these are the basic causes, but yes, in this report we will understand and decode the trends. As the name of this report is Trends in Maternal Mortality, and these trends we will be analyzing from the year 2000 till 2023. This is the 23 years period. Now, India has shown immense progress during this period. And after that immense progress also, maternal mortality remains to be high, second highest. So India has shown prominently one of the countries with the highest maternal mortality rates at that time, and now also it remains. And I would say one of those countries in which reduction has been substantial. During this time period, 78% reduction in maternal mortality has happened. So we will see to this as well. Now this report, who prepared it? Multiple organizations, World Health Organization, UNICEF, UN Population Fund, World Bank and UN Department of Economic and Social Affairs. And this particular report highlights trends, causes and regional disparities that contribute in maternal mortality. So, we will now be focusing on India. Now, key facts and figures from the report. India recorded 19,000 maternal deaths in 2023 alone, ranking second globally, tied with Democratic Republic of Congo. Now, it is said and believed that when a woman delivers birth or a baby, it is the second life of the woman because she has to undergo a lot. And in that due process of undergoing a lot, there can be complications. There can be complications due to multiple factors which we will be discussing. And these complications can lead to the death of the woman. And so in 2023, 19,000 such deaths happened in the country, where we were the second highest along with Democratic Republic of Congo. Highest number of deaths were in Nigeria, 75,000 deaths. India and DRC each represent 7.2% of the global maternal deaths, while Pakistan had about 11,000 deaths, accounting for 4.1%. Now, since we are talking in absolute numbers, so yes, in absolute numbers, India's population is also 1.4 billion, which none of these countries' population is. So, as a percentage, it is less. But yes, in absolute numbers, if I talk about, it is the second highest. Now, these four countries, Nigeria at top, India and DRC at second position and Pakistan at the third position, they constitute 47% of all the maternal deaths which happened last year. Roughly 50% of these maternal deaths happened in these four countries in 2023. Now, maternal mortality ratio. This ratio is deaths of women during childbirth per 1 lakh live births. It improved from 362 in 2000 to 80 in 2023, marking a 78% reduction over this 23-year-old period. And if I compare it with China, so China also reduced its MMR. It was 56 in 2000. This figure was 362 for India in the year 2000. And it has reduced it to 16 in 2023. This is also a 70% reduction. But yes, if you see in absolute numbers, there is a huge difference between 16 per 1 lakh live births in China and 80 deaths per 1 lakh live births in India, still in 2023. Despite these improvements, India's MMR of 80 in 2023 is still higher than that of China, signaling the ongoing challenges which India is facing. Now, let us discuss about the global trends in maternal mortality as well. Now, globally, maternal deaths decreased by 40%. Individually, in India, it reduced by 78%, in China, it reduced by 70%, but global average is 40% reduction during this time period, 2000 to 2023. And in this period, there were a total 260,000 maternal deaths which happened worldwide in 2023 alone. So, 2023, we saw that figure 19,000 for India, 75,000 for Nigeria. So, globally, it was 260,000. Now, this equates to one maternal death approximately every 2 minutes globally. And the global decline in maternal deaths is largely attributed to improved access to essential health services. That is, I would say, one of the major root causes, lack of availability of essential health services, which leads to maternal mortality. Now, the impact of COVID was also assessed in this report. So, as I mentioned earlier, that during COVID-19 pandemic had a significant impact on maternal mortality. Let's go through numbers. In 2021, 40,000 additional women died due to pregnancy or childbirth due to the pandemic. Increase in death was caused by COVID-related complications. They contracted COVID, the pregnant women, and the disruption of maternal health services, as the healthcare staff and all, they were more diverted towards tackling the pandemic. Many healthcare systems were overwhelmed and women couldn't access the unnecessary or necessary medical care, leading to higher deaths. And total number of maternal deaths in 2021 were estimated to be 322,000 compared to 282,000 in the previous year. So, this was there, and currently 2023 it was 260,000 deaths. So, clearly we can see that during the COVID year it was 322,000, more than the previous year, that is 2020, and more than now also. Why? Because many of these pregnant women contracted that infection. Second reason, many of these women were not able to have access to the medical facilities because there was heavy disruption in the medical facilities. Resources were more diverted towards tackling the situation over there. That is the COVID situation. Now, causes of maternal mortality. What are the causes of maternal mortality? One is this direct obstetric causes. Hemorrhage, severe bleeding is the leading cause of maternal death, and this happens in or during childbirth, whether it be cesarean or it be normal delivery. Other significant direct causes of maternal deaths include hypertensive disorders. Example, preeclampsia, infections such as sepsis, and complications from unsafe abortion. They also undertake unsafe abortions, due to which their life is at threat. Indirect cause. There are multiple indirect causes like non-communicable diseases, NCDs, like diabetes, hypertension, and heart conditions. These are increasing indirect causes of maternal deaths. So, when a woman undergoes labor pain, then multiple factors are at play, and there are chances of cardiac arrests at that time. Labor pain happens just before delivery. So, many a times this happens also, that women lose their lives due to cardiac arrests. Apart from it, gestational diabetes and hypertension, I have already discussed. These conditions are predate pregnancy or develop during pregnancy, increasing the risk for the mother. There are these mental health issues also, because she is undergoing a major change in her hormonal balance of the body, so which creates a lot of mental health issues, including depression and substance use disorders. So, this also causes conditions like gestational diabetes, epilepsy, and asthma also increase the risk of complications during pregnancy. So, these are indirect causes. Direct causes, hemorrhage, blood loss is there. Apart from it, there are other systemic challenges like lack of availability of infrastructure and all. But yes, coming on to the regional disparities in India. So, southern states, they have better developed human development indicators like Kerala, Tamil Nadu, and Karnataka. We can see better healthcare services delivered over there, better access to private healthcare, and better public health infrastructure as well. Whereas all these things are missing in the northern states, including Uttar Pradesh, Bihar, Madhya Pradesh. This is mainly due to limited healthcare infrastructure, lack of trained healthcare professionals, and low socio-economic conditions. Low socio-economic conditions of the people compel them to go to the government or public healthcare setups. Public healthcare setups are not that much developed. Private healthcare setups are also there in these northern states, but people do not have the capacity due to their socio-economic conditions. So, that is something which is concerning. Then in the northern states, primary health centers and community health centers often lack resources and specialized staff to handle complicated pregnancies or emergency situations. And when complications arise, they refer to a larger public hospital which is there at the regional level or something like that. But many people do not have the resources even to reach those larger hospitals, due to which these deaths are there. And that is a dark reality. There is nothing, I would say, exaggerated over here. The socio-economic disparities. Women from poorer and rural regions often have limited access to quality healthcare, because public healthcare systems which are free of cost are not developed up to that level. In these regions, private hospitals may be inaccessible due to high costs, and many families rely on under-resourced government healthcare centers. The economic capacity to afford private healthcare is higher in southern states, leading to better maternal health outcomes there. In contrast, northern states with poorer socio-economic conditions see more maternal deaths due to lack of emergency obstetric care. So, capacity is not there, infrastructure is not there for obstetric care and all, so leads to MMR or maternal mortality. Then public health centers and community health centers. PHCs and CHCs in India are generally equipped to handle normal deliveries, but often struggle with complicated cases. Complicated cases, they turn into C-sections, cesarean sections, or blood transfusions are required. This is what is part of obstetric care, and this is not available in the PHCs and CHCs. Women with complicated pregnancies may be referred to higher level facilities, but many do not have the means to reach them in time. This is what I mentioned earlier as well. So, this is lack of infrastructure that has to be dealt with. Preventable causes of maternal deaths. Preventable causes such as hemorrhage, loss of blood can be prevented, hypertensive disorders, infections, unsafe abortions, they all are preventable. If there is a will, there will be a way. There is an intent, then the outcomes will be there. But there should be a will and there should be an intent, which is missing. Despite the availability of clinical interventions to treat these conditions, many women still die due to inaccessible or inadequate care. And this inaccessibility is primarily due to the socio-economic conditions. Poor and vulnerable sections of the society, they are not able to reach these services. And this is especially true in low income or conflict affected areas, as I mentioned. So, these preventable causes can be prevented, but yes, unfortunately, they are not prevented. Now, key recommendations in this report to address maternal mortality. Obviously, improving healthcare access, strengthen healthcare infrastructure in unserved and underserved areas, primary health centers and community health centers, which are public health centers, free of cost, those should be developed. Ayushman Arogya Mandirs, primary health centers are referred to as, their capacity should increase. Then, increasing emergency obstetric care. Emergency obstetric care like cesarean sections, blood transfusions in public healthcare centers should be there. It should not be like, bhai, our hospital cannot do it, it is a complicated case, refer to the higher one, people cannot reach over there. Cases, pregnancy cases or delivery cases, they are, stretched to such an extent that nothing can be done or very less chances of being done, then they are referred, then there is a problem. So, these things are concerning. So, the primary healthcare centers and the community healthcare centers should be equipped with adequate infrastructure, adequate, I would say, equipments to deal with such kind of complications then and there. Health education and family planning. This is very important because this is the best kind of preventive care which can be given to the females. So, family planning services should be expanded and women should have better say or better access to birth control, prenatal care and postnatal care. Health education should be focused on encouraging regular checkups, teaching women the importance of seeking care early during pregnancy, the importance of visiting healthcare centers regularly, undergoing scans, then eating healthy diet and all these things should be there. Tackling socio-economic barriers, government should focus on reducing socio-economic inequalities by improving access to healthcare for low-income families and ensuring that all women, especially in the remote areas, have access to skilled medical care. And addressing the impact of COVID, such kind of pandemics can come in the future also, and these pandemics should be taken care of. It should not be like history is repeating itself. The cases, the number of maternal mortality cases are rising during pandemics. These should be unimpacted and there should be specialized care to pregnant women who contract such kind of diseases. So that is what we need to know and understand. And yes, maternal mortality is a very, very important indicator for the economic development of any country. If MMR is high, then we can definitely say that the country is not so much developed. We need to bring it under control. We have come a far way, reducing it by 78% from 2000 to 2023, but we should be doing more in this. We should be doing more in this because we deserve to be better. We deserve to be better placed. We deserve to be a developed country by 2047. And for that matter, we need to be a healthy population. After all, health is wealth. Next is Women and Men in India 2024. This report is released by Ministry of Statistics and Program Implementation, and this is the 26th edition of this report. It is an annual publication and it generally takes a comprehensive view about the gender landscape in India. We've been talking about gender empowerment, women empowerment a lot. And in this particular report, multiple areas are focused upon like education, health, economic conditions, decision making, participation in politics. All these parameters are covered and we can see that how women are performing. Now, key highlights of this report. First, education, gender parity in education. The primary and secondary education we talk about. So, gender parity index shows the participation of women as compared to men, and it is consistently high at the primary and higher secondary levels, indicating strong female enrollment in these educational studies. However, there have been fluctuations in the GPI, that is gender parity index in the upper primary and elementary levels. So let us see. This is the graph which you can see. Anything above 1 is women are performing better than males. So here we can see 1.07, 1.07, 1.02, 1.03. Female participation is good in this gender parity index. Labor force participation rate, and how many women are there in the society, and among them how many women are participating in the labor force. This rate highlights that. And for women aged 15 years and above, LFPR, that is labor force participation rate, has improved from 49.8% in 2017-18 to 60.1% in 2023-24, means 60.1% of the females in India are participating in the labor force somehow or the other. And it represents a significant rise in women's participation in workforce, reflecting both improved opportunities for them and the ecosystem also favoring women. I'm not saying that women should be there in MNCs. Anyway, women are earning. If women are participating and contributing in the farms, that is also, women are becoming part of the 60.1%. And since they are contributing in any economic activity, they have a different say in the decision making in their respective homes. That is what we need to understand and know. Talking about financial inclusion, bank accounts and deposits. Women own 39.2% of the total bank accounts in the country, and 39.7% of the deposits in these bank accounts are of females. Now, the overall deposits in India, if I talk, 39.7% of the overall deposits are by females. Female participation in banking is highest in rural areas. This is something which is remarkable, where women make up 42.2% of bank account holders. This reflects a positive trend towards financial inclusion. Obviously, this is great. Demat accounts. These are those accounts through which you can participate in the stock market. So this number has also been on the rise for the females. So from March 31, 2021 to November 30, 2024, the total number of Demat accounts grew from 33.26 million to 143.02 million, marking a rise of over 4 times. Male account holders still outnumber female account holders, no doubt about this fact, but female participation in the stock market is growing. That is something which is good, because this is also a source of income. And yes, everyone should have equal access to these sources. Then women in entrepreneurship. One good thing is that this number is also on the rise. The publication highlights the growing trend of women entrepreneurship. Female-headed proprietary establishments have risen across sectors such as manufacturing, trade and other services over 2021-22, 22-23 and 23-24. There has been a notable increase in number of startups with at least one woman director in them. So, number of startups has also increased from 1943 in 2017 to 17,405 in 2024. Basically, these are those startups in which at least one woman is a director. So yes, definitely they are moving towards, more and more empowerment. So here overall, if you can see, the 26.2 is basically these number of startups in which women director is there. But if I talk about, manufacturing, 58.4% it is there, then 13.7 in trade and other services, 14.2. So percentage of female headed proprietary establishments. So that is substantial. And the good thing is that in 58.4% of startups which have been established for the manufacturing sector, in 58.4% of them, at least one woman director is there. So yes, this is also on the rise. All these pillars definitely highlight that, women participation is increasing. Electoral participation. There are somewhere around 98 crore voters in the country, 978 million in 2024. And, in 1952, when we became independent, there were 173.2 million voters, and it has increased substantially. Female voter registration, there has been a notable rise in female voter registration, showing increasing participation of women in democratic processes. Female voter turnout is also good. It has varied over the years. It reached 67.2% in 2019 elections, but slightly declined to 65.8% in 2024. And despite this slight decline, female voter turnout surpassed male voter turnout in 2024. Means females voted more as compared to males in 2024, and this was the learning taken by the politicians, and that is why you see in every state elections after that there has been a scheme announced for the females. Even the Delhi elections, Haryana elections, now the Bihar elections coming up, everywhere, because women voters are more than the male voters. This is what is reflected in this. Gender and socio-economic trends, if I talk about the gender parity index in education, we saw that how women participation or women's enrollment is increasing. Then labor force participation rate, women participating in or as part of the labor force, they are on the rise. Financial inclusion, women's involvement in the financial sector, especially through bank accounts and demat accounts, is growing. So that is also, good. Number of, I would say, bank accounts are increasing, and the deposits in those bank accounts is also on the rise. So this is very, very important. In this particular report, it was all displayed that how the women's position is rising. No doubt there are many gaps, there are many challenges which these women encounter in their day-to-day lives. And the biggest challenge they encounter is the psychological challenge of patriarchy. That should be addressed. And with the rising levels of education, awareness and exposure, obviously these kind of psychological challenges can also be dealt with. So yes, we need women to be part of the development journey, then only we will be there by 2047. If women are not brought into the net, we don't know whether it is 2057, 67, 77 or beyond that also. Let's not hope for that. Let's only hope for 2047. That is it. Now coming on to the MCQs. Which of these organizations was part of releasing the report titled Trends in Maternal Mortality 2000 to 2023? WHO, UNICEF, World Bank, multiple agencies released it. Find the correct combination. Second, consider the following statements with respect to maternal mortality from 2000 to 2023 and mark the correct one. Maternal mortality reduced by more than 70% in India. Reduction in MMR in India has been more than China in percentage terms. Carefully answer this. Only one, only two, both one and two, neither one nor two. Third question, which of these are considered as factors responsible for high MMR in India? Lack of obstetric care, diabetes and hypertension, mental health, lack of availability of adequate nutrition during pregnancy. Only 1 and 4, only 2 and 3, only 1, 2 and 4 or all of the above. Fourth, which organization releases Women and Men in India report? Ministry of Social Justice, Niti Aayog, Ministry of Statistics and Program Implementation or none of the above. Carefully answer these questions. Now coming on to the MCQs of yesterday. Which of these is known as the sacred city of Sri Lanka? This was a very direct question, straightforward. It is Anuradhapura. Consider the following statements with respect to Mitra Vibhushan and mark the correct one. This award was given to our Prime Minister. It is Sri Lanka's highest civilian honor given to foreigners only. Yes, it was started in 2008 by Mahinda Rajapakse. It is higher than Sri Lanka Ratna in stature. This statement is also correct. It was explicitly mentioned in our notes. So both 1 and 2 are the correct options. Third, which of these countries share a boundary with Cambodia? So here we have Cambodia as a country. So we have Thailand, we have Laos, we have Vietnam sharing it. So Thailand, Vietnam, Laos, all the three share it. Hence, all of the above is the correct option. And fourth, which country partly contributed in building the Ream naval base in Cambodia? This is also a direct question and the answer to this is USA. So, with this, we come to an end of today's session. I will be seeing you tomorrow now with more such informative news pieces. Till then, you guys very well know what to do. Keep studying, keep reading, keep writing, and most importantly, keep revising. Namaste, Jai Hind.